I rise today to introduce a bipartisan resolution recognizing the 40th anniversary of the National Cancer Act of 1971, supported by 33 Democrats and 11 Republicans. Special thank you to Massachusetts Senator John Kerry and Kansas Senator Jerry Moran for their leadership on this issue. It's unfortunate, but likely true, that we each know someone who's been affected by cancer. We know a survivor, we remember a victim. We know that cancer affects not just the patient, but the parents, the family, the friends, the loved ones. This year, more than 1.5 million Americans are expected to be diagnosed with cancer. 1 of every 3 women, 1 of every 2 men will develop some form of cancer in their lifetimes. More than 500,000 Americans die from cancer year after year after year. In any one year, more than 1 person every minute. Nearly 1 of every 4 deaths is from cancer. We also know that behind the statistics, there are thousands of people representing thousands of friends and families and loved ones with ribbons and donations and races for the cure. These are the stories that motivate us to fight harder and to fight with one voice. There's also a story of a nation's commitment to cancer research. There is interest in dealing with environmental causes. There is great interest in dealing with cures and prevention and all that we should as a nation and usually do know what to do. 40 years ago, Ted Kennedy, Senator Kennedy from Massachusetts, as chairman of the Health Subcommittee, forged a bipartisan consensus and public demand to bolster investments in cancer research. He held hearings. He worked with leading public health advocates and economists who understood the need for bipartisanship for such an urgent national need. His work, along with Jacob Javits, a Republican of New York, led to the framework of the National Cancer Act. And when it was clear President Nixon would only sign the act into law if Kennedy's name were not on it, Kennedy backed off. The goal was to put cancer research into a new era of discovery, and that's what the Cancer Act did. It established a national cancer program, which expanded the authority and the responsibility of the National Cancer Institute and its parent, the National Institutes of Health. The National Cancer Institute is by far the biggest of the 24 or so National Institutes of Health. Today, 12 million cancer survivors are alive because of the advances in the way we prevent, we detect, we diagnose, and we treat cancer. And because of the investments by the NCI, the Cancer Institute, and the National Institutes of Health, critical cancer research is being conducted in hospitals and foundations and communities and in all kinds of centers everywhere in our universities. I'd like to insert into the record a list of more than 100 cancer research institutions, physicians, and researchers who have endorsed this resolution. If I could have unanimous consent for that, Mr. President.
Without objection.
Thank you, Mr. President. It includes scientists and physicians working together in cancer research everywhere, from the James in Columbus to Case and UH in the clinic in Cleveland. Ohio's universities and medical schools, teaching hospitals, Cincinnati Children's Research, small businesses and other research institutions help bring cutting-edge cancer treatments to cities and to small towns alike. For the last 40 years, our nation's commitment to cancer research has seen a tremendous return on investment in the millions of lives and the billions of dollars saved. We've increased survival rates, we've advanced understanding of the diseases and the tools needed to cure them. We've better understood the connection between environmental factors and public health and diseases. We've realized the importance of prevention. We also know challenges remain, from finding more treatments to learning more and carrying out prevention better than we have, for dealing with environmental factors that we know cause large numbers of cancers, and reducing costs for patients, to reducing disease burdens for different population groups. Today's bipartisan cancer resolution on the 40th anniversary of the National Cancer Act reaffirms a commitment to address this national priority, to make sure that cancer is a thing of the past. Senator Kennedy said in those days, 40 years ago, when his legislation began to move forward, there are few better investments in our future than the investment we make in better research.